Hello and welcome to LJIP e-learning session initiative taken by Lok Jagruti Kendra. Myself, Prachi Joshi from Department of Pharmaceutical Technology. Today in this session, we will be learning about non-linear pharmacokinetics. The main objective is to understand what is non-linear pharmacokinetics, difference between linear and non-linear pharmacokinetics, understand the major causes of non-linearity, and Michaelis-Menton equation. Now, what is pharmacokinetics? You can term it as quantitative study of the drug movement in and out of the body. It is also termed as the characteristic interaction of drug and body in terms of ADME, that is absorption, distribution, metabolism and excretion. Again, pharmacokinetics is divided into linear and non-linear kinetics. So firstly, we'll understand what is linear kinetics. Linear is simply first order kinetics. Here, when change in amount of drug in the body or change in amount of drug in plasma drug concentration is due to ADME is directly proportional to the doses, and all the pharmacokinetic parameters such as bioavailability, elimination rate constant, half-life, systemic clearance, etc. would not change when different doses at different single or multiple doses are given through different routes. This termed as linear, or you can say that first order kinetics. Now, what is non-linearity? So it is opposite of linear kinetics. Here you can say that the pharmacokinetic parameters will show deviation. It will deviate from linear pharmacokinetics, and so it is dose dependent kinetics also. Here the rate process of drugs ADME is also dependent upon carrier or enzyme that are basically drug specific. So hence, when the drug or the carriers get enzyme, or you can say the carriers get saturated at the higher dose, it is also known as capacity limited kinetics. So you can say that at lower doses it will show first order kinetics, but at higher dose it will show zero order kinetics. So it is termed as mixed order kinetics. So non-linear kinetics has three names, that is first dose dependent kinetics, capacity limited kinetics, and third is mixed order kinetics. Now you can see that on your screen there is a graph which represents area under the plasma level time curve versus dose of the drug that exhibits a saturable elimination process. So there are two curves, curve A and curve C. So curve C is indicating that it is dose independent, which means it is following linear kinetics. So it has a exponential line. So when dose increases, there will be change in area under the curve as per the straight line. So it will be changed exponentially. But what happens in the case of curve A? It represents dose dependent, or you can say saturable elimination kinetics. So it means that at low dose, what happens? It is showing the similar characteristic as of curve C. But as you go on increasing the dose, or you can say you are repeating the dose, then what happens? It is getting deviated from the linearity. It shows deviation. So this deviation is termed as non-linearity. So again, zero and first order is playing the role. So it is known as mixed order kinetics. So you can see this in a tabular form also, that linear is dose independent while non-linear is dose dependent. Linear is showing first order kinetics while non-linear shows mixed order, that is first and second order kinetics. Now, how to detect non-linearity? So you can see that there is a graph representing linearity. So if the steady state plasma concentration at different dose is showing direct relation, or it is directly proportional to the dose, then it will be having a linear kinetics. If it is not directly proportional to the dose, it will be having a non-linear pharmacokinetics. Okay. So the second one is, as we have seen earlier, that in linear kinetics, the pharmacokinetic parameters does not change. But in case of non-linear, the pharmacokinetic parameters changes. Now we can explain that. Let us take an example of phenytoin. So when phenytoin, it is an anti-epileptic drug. So you can increase its dose from basic like 300 to 450 mg. Okay, so what happens is it is increased like 10-fold, we have increased 50%. So this will cause major change or major alteration in pharmacokinetic parameters. It will be not directly proportional. Okay, so this is showing the non-linearity. So similarly, if there is change in bioavailability, T half, that is half-life, systemic clearance, which are usually constant in the case of linearity. So if there is deviation in all these pharmacokinetic parameters, we can conclude that it is showing non-linearity. Now, what are the stages of non-linearity? So there are basically absorption, second one is distribution, third one is metabolism, and fourth one is excretion. So all these four stages involves enzyme or carrier mediated system. So if they are getting saturated at any level, okay, so there is the stage of non-linearity. Again, besides saturation of plasma protein binding or carrier mediated system, drug may demonstrate non-linearity due to pathologic alteration of drug absorption, distribution and elimination also. So let us take an example of aminoglycoside. Aminoglycoside causes linear nephrotoxicity. So basically it will alter renal drug excretion. So it is again a pharmacokinetic parameters which is getting altered in the case of elimination, that is excretion. So at this stage it is a cause of non-linearity. So let us understand the cause of non-linearity in detail. First one is drug absorption. There are three major causes of non-linearity in drug absorption, where first one is when drug absorption is solubility or dissolution rate limited. Now let us take an example of griseofulvin. So when you are given this drug in higher concentration, it will form a saturated solution in the GIT, or you can say at any other extravascular site. So what happens is the rate of absorption attains constant value. Okay, it will attain a plateau region. So this will deviate, this will decrease all the pharmacokinetic parameters like bioavailability, drug absorption, then Cmax, AUC. Okay, similarly, in the second case also there is carrier mediated transport. Here the carriers get saturated because of the higher drug concentration. Okay, so example is you can take riboflavin, then ascorbic acid. So this kind of drug will saturate this carrier system or enzyme system in the case of when it is in a higher concentration. So again there is a deviation in pharmacokinetic parameters, and again similar to the above case, here the pharmacokinetic parameters bioavailability, Cmax, AUC get decreased. The third one is a little bit a different case where the pharmacokinetic parameters increases. So basically there is alteration, correct? So any kind of alteration will lead to non-linearity. So here in the third case what happens is pre-systemic gut wall or hepatic metabolism attains a saturation level. So anything which attains a saturation and attains a plateau region will have a zero order kinetics over there. Okay. Now, second one is drug distribution. In case of drugs distribution, what happens is there is a saturation of plasma protein binding site and there is a saturation of tissue binding sites. Okay, so in both the cases, what will happen? The free plasma drug concentration will get increased, but the volume of distribution will increase in the case of plasma protein binding only. But other pharmacokinetic parameters, that is VD, that is apparent volume of distribution, will decrease in the case of a tissue protein binding in this case because of saturation of sites, tissue binding sites. Okay, but the linear the clearance, you can say, with higher excretion ratio gets increased due to saturation of binding sites. Now we can move towards drug metabolism. Again, here two important causes are there. Capacity limited metabolism. Now, what is the meaning of capacity limited metabolism? Here, what happens is enzyme or cofactors get saturated. So when it attains a saturation, again there is alteration in pharmacokinetic parameters and it will attain a plateau region. Okay. Now what is the meaning of plateau region? Every time I'm explaining, we'll see in further in the slides, but still to make you understand and you won't get confused because of this plateau region. Plateau region is the straight line, constant value. Okay, there is no change, further change, even if you change the drug concentration, even if you increase the drug concentration, the value won't increase exponentially. It will have a curve and will have a straight line after that. It will indicate a constant value. Okay, so now second one is enzyme induction. Enzyme induction is basically decrease in drug metabolizing capacity or ability of enzyme. So ultimately there will be decrease in Cmax. So again Cmax is pharmacokinetic parameters. It will decrease. So this will attain non-linearity. Other causes is similar: saturation of binding site, pathological condition, changes in hepatic blood flow. Moving on to the fourth one is excretion. There are two processes which again get saturated over here. At higher doses, what happens is active tubular excretion and active tubular reabsorption. Carrier system attains saturation. So again, the pharmacokinetic parameters, that is renal clearance, in both the cases will be decreased. Okay, so there is a change in pharmacokinetic parameter. So as I explained you earlier, if there is any alteration or change in pharmacokinetic parameter, it will cause non-linearity. Similarly, there are other causes like changes in urine pH, nephrotoxicity, then saturation of binding site. All this will cause what? Non-linearity. Okay. Now, moving towards Michaelis-Menton equation. We have discussed this non-linear pharmacokinetics. But let us now understand in the form of equation, in the mathematical form, what is kinetics of capacity limited or saturable process. You can best be explained by Michaelis-Menton equation, which is also known as equation. Here, minus dC upon dt is equal to Vmax into C upon Km plus C. Now, what this equation tells you is dC by dt is decline in drug concentration, rate of decline in drug concentration with time. Vmax is maximum rate of process. Now, what is the meaning of maximum rate of process? No change in velocity. The plateau region, maximum. Whatever you are going to increase, it will have the same value. So that will attain a maximum value and that velocity is known as Vmax. Km is Michaelis constant. It is also known as Briggs-Hayden constant. Now, what does this Km indicates? Basically, it explains that affinity of the enzyme for the drug. Okay, so if the value of M is less, then it will indicate that it has more affinity for the drug. But if there is the value is increased of Km, you can say that it has attained a saturation stage. Enzyme has attained a saturated stage and there is no more affinity or no more active site for the drug to bind towards the enzyme. Okay. Now let us understand it with the graph. See, this graph tells you that it is a mixed order kinetics. Like how? Firstly, you will see the region that is first order region, or you can say a linear region, which indicates that the dose initially is very small. Okay. Now, then there is increase in the dose and it will attain a plateau region. Okay. So basically, this graph explains you the relation between elimination rate and plasma concentration of a drug that exhibits dose dependent pharmacokinetics. At the higher dose, it will attain a saturation and the elimination rate process will attain a saturation. It will attain a maximum position, which is also indicated by Vmax in the graph. Okay. So you can say that first order is increase in velocity with increase in drug concentration. Zero order or plateau region, the straight line, okay, is a plateau region. There is no increase in velocity despite of increasing the dose, and in between that there is a Michaelis Menton region where there is deviation begins. Okay, so you can say that when elimination rate is half of the maximum elimination, okay, when V is equal to V max by 2, then Km is equal to C. Km is equal to the drug concentration. Okay, this equation you can consider by three conditions. So let us see the three situation. Depending upon the value of Km and C, you can get different values like first order, second order, mixed order and zero order kinetics. So first condition is when the concentration of drug is very less than Km. Okay, or you can say that the value of Km is very high. Okay, so what happens is initially the concentration is very less, so you can say that you can eliminate the value of C. So equation becomes Km plus C is equal to M. You can eliminate or neglect the value of C as it is very negligible. So we can arrange the equation number 1 and we can get minus dC by dt is equal to Vmax into C upon Km. Correct? Here the value of Km and Vmax are constant. So you can again hide that, or you can consider it as a constant value. So it will be in the equation that it is directly proportional. Minus dC by dt is what? The rate of process with respect to time is directly proportional to the concentration. Correct? So at low concentration, it will indicate first order, as we have earlier seen in the graph also. Now let us consider the second value when C is equal to Km. So now Km plus C is equal to 2C. So again we are rearranging the equation number 1. We get minus dC by dt is equal to Vmax by 2. So the rate process is half of the maximum elimination rate. Correct? So you can say when there is a medium dose, it will follow a mixed order, the Michaelis region. See again in the graph. First order, then there is a Michaelis Menton region. Now we can consider the third one when the dose of the drug is very large than Km, opposite to the first condition. Okay, so Km plus C is equal to C. Okay, so here we can eliminate the value of Km. It is similar to the first elimination what we did for we can say C. Here we can eliminate the value of Km, or we can say we can neglect it as it is very less. Okay, so again we will be rearranging the first equation. So here we can get is minus dC by dt is equal to Vmax. Again, here the value of minus dc upon dt, that is rate process, and Vmax, both are constant values. Okay, so what happens is at higher concentration, C is here is very large. So the dose of the drug is very large. So what will happen? The rate process will attain a saturation. So that is indicated by zero order kinetics. Thank you for listening this session very patiently. Subscribe our channel, that is Pharma Ignite on YouTube, and keep learning. Stay safe and stay in. Thank you. Till the next session.